Right. So the next tool that we want to discuss is the DAST. The DAST is the primary school screening tool we'll discuss for substance use. The recommended single question pre-screen is how many times in the past year have you used an illegal drug or used a prescription medication for non-medical purposes? I think this is a little tough maybe for a teen to use, so you might have to call it a legal drug or someone else's prescription medication or a medication that was not prescribed. So you may need to change the wording slightly for your population. However, this is the wording that was validated and approved with that. So use your judgment on how best to communicate with your population. Any positive result on the drug pre-screen question puts the patient or the person in an at-risk category. The follow-up questions are to assess the impact and whether use is serious enough to warrant a substance use disorder diagnosis. If the response is never, screening for drugs is complete. If there are some overt clues, for example, the person appears high or intoxicated, you'll want to inquire further. If the person responds positively, no matter how many times, whether once or multiple times, that person is viewed as at risk and should be further screened for substance use. Although many people take medications not prescribed to them, we're primarily concerned with opioids such as oxycodone, hydrocodone, fentanyl, methadone, benzodiazepines, clonazepam, alprazolam, diazepam, stimulants such as amphetamines, dextroamphetamine, methylphenidates, sleep aids such as zolpidem, zaleplon, and I can't pronounce that one, I'm surprised, and other assorted medications such as clonidine. If someone says yes, and they say they took someone's antibiotic, for example, that would not be a concern about their prescription drug misuse. I should say it is a concern to me as an RN, it is a concern, but it's not a concern for our topic today. So what's the DAST? The DAST-10, we're thankful for this. It's been shortened from the original 28 questions. And it parallels another alcohol screening instrument developed by Addiction Research Foundation. And it has a quantitative index of problems related to drug misuse. So it's very sensitive as far as its ability to identify at-risk drug use, but it does not include it does not include alcohol use. This is why we use the two questions for the pre-screen, one an alcohol-focused question and the other a drug-focused. It was originally developed by the Addiction Research Foundation, and it can be completed through self-report, interview, or electronically. So depending on a person's reading level, for example, their access to electronics, or the particular setting that you're employed in, you can implement it any of these ways, and they've all been validated. Specificity around this instrument's high because it's a simple yes/no answer, and it's shortened, so it is more user-friendly, I guess is the word I'd say. And it's also a public domain tool. So again, to interpret this, we see the different scores, the degree of a problem, and the action. And I will again say, when no problems are reported, the suggested action is none at this time. I really believe in affirming those who are having these healthy behaviors. So I do think the action of that time should be affirmation that they are participating in healthy behavior. Low level, we want to reassess. Once again, you want to encourage no use and then reassess that. Moderate level, we want to do a brief intervention and work to decrease use and assess further. And then your substantial level, those are the folks that will certainly need a referral out, because that's, as I like to say, above my pay grade. But those referrals are rare, but they can be difficult to find someone to refer to. So we have to use all of our resources to do that effectively. Somewhat similar to the audit's results, the DAST reveals about 40% of persons reporting no level of illicit substance use during the past year, or use of medications in manners they were not prescribed. About 35% of persons scored what's referred to as a hazardous level. Harmful use is 20%, and someone less than 5% of the population are viewed as high risk, roughly equivalent to dependent levels of use. So that's an introduction to the DAST. And next we will be proceeding on to look at the craft.